Welcome to the E-Phi chapter Toys You Can't Return workshop. Toys You Can't Return is a national program of Iota Phi Lambda sorority, and it focuses on the following domains for pregnancy prevention. 1. Future career direction. 2. Realism about child rearing. 3. Personal life purpose. And 4. Sexual self-value and knowledge. Today's workshop will focus on the fourth domain, sexual self-value and knowledge. We hope that you gain a lot of information from our special guest presenter for today. Our presenter for today's workshop will be Dr. Wintria Cunningham, an obstetrician gynecologist from Houston, Texas. Dr. Wintria Cunningham is a vibrant young lady at the pinnacle of her career. She is a best-selling author who completed her undergraduate studies at Texas A&M University. And because she bleeds maroon, she also received a master's in public health from the Texas A&M University Health Science Center School of Rural Public Health, as well as her medical doctorate from Texas A&M Health Science Center College of Medicine. Dr. Cunningham completed her residency in obstetrics and gynecology at the UT Houston McGovern Medical School. Dr. Cunningham specializes in treating a variety of obstetric and gynecologic issues plaguing women. She performs invasive and minimally invasive surgery, including laparoscopic surgery. Dr. Cunningham loves people and believes in treating the total person, mind, body, and soul, and her diverse and well-rounded background empowers her to do just that. Dr. Cunningham is also a minimalist who likes to think outside the box when treating patients and solving problems. Her special interests include cosmetics, aesthetics, and chronic vaginitis. When she's not seeing patients or operating, she enjoys quiet time at home, retail therapy, working out, spending time with family, writing, and interior decorating. Her motto is humility before honor, and she encourages everyone to live your best life, not anyone else's life, but your best life. We now present to you Dr. Wintria Cunningham with the special video presentation for our Toys You Can't Return workshop for today.
My name is Dr. Wintria Cunningham. I'm a licensed obstetrician gynecologist in Texas, and I was asked to provide a video presentation for the Toys You Can't Return campaign, which is an excellent campaign. As a healthcare provider, I thought it would be important to talk about understanding your body. That's such a broad topic, so I thought we would focus our efforts on talking about puberty, which is the hallmark of change that every young girl and boy goes through on their way to becoming a full-fledged adult. Puberty. There's no way we can discuss every aspect of puberty during this short talk, so I thought we'd focus on the following things. Understanding exactly what is puberty, looking at the stages of puberty, and lastly, answering the age-old question of whether or not you can speed puberty up or slow it down. Let's just jump right in. What is puberty? Puberty is the name for when your body begins to develop and change. During puberty, your body's going to grow faster than any other time in your life, except for when you're an infant. And it's important to talk about these changes. It's also important to talk about these changes before they happen. It's important for you to remember that everyone goes through puberty, no matter who you are, no matter where you live, no matter if you're a boy or a girl, everyone goes through puberty. And guess what? All of us adults have one thing in common. We made it through puberty, and so can you. The average onset of puberty for a girl is age 8 to 13, and for a boy, age 10 to 16. So let's talk about the different stages of puberty, whether you're a boy or a girl. The first stages of puberty are all behind the scenes. What do I mean by that? Well, they all happen internally. Nothing externally is going on at that time. It's all behind the scenes. It's all within your body. So you don't feel when you first start puberty. That's because your brain is producing a special hormone that starts the changes of puberty. This hormone is called gonadotropin releasing hormone, or GnRH for short. GnRH will then stimulate the pituitary gland, which is another gland that's found in your brain, to produce two additional hormones called luteinizing hormone, or LH for short, or follicle stimulating hormone, or FSH for short. These two hormones are going to work independently on separate organs, whether you're male or female. So basically they act different ways depending on if you're a guy or a girl. If you're a guy, FSH and LH are going to stimulate the testes to produce sperm and also a hormone called testosterone, which is going to be the main hormone that's going to be responsible for all of the changes that happen within a guy or a male. For a female, FSH and LH are going to target your ovaries. They're going to stimulate your ovaries to produce estrogen, which is the main hormone that's going to cause all the changes in a female or a young girl. It's also going to work in conjunction with LH and FSH to start your menstrual cycle. We'll talk a little bit more about that in a moment. So as you can see, the major changes or the starting changes of puberty happen all behind the scenes. It's all internal. You don't feel any of this going on, but it's super important. And it happens when you reach a certain age. And whether that age is 8, 13, 10, 16, it's going to happen. It's a predetermined age before you were born. If you are a girl, the first external sign of puberty is going to be development of breasts. So once your breasts begin to grow and develop, this is how you know you've started puberty. After that, you may notice that you have an odor, meaning a body odor. You may start to think that you need to wear deodorant for whatever reason. Mainly it's because you're starting to sweat more. So all of the hormones that are going to be produced during puberty are going to act on your sweat glands and cause them to produce chemicals that have an odor to them. They don't smell very nice. So it's not your fault that you're having to wear deodorant at that particular point in time. It's all part of the changes that are happening to make you an adult. In addition to starting to wear deodorant, you may also notice that you start to develop acne. So this is a very frustrating time for teenagers because you're always having breakouts and things like that, and you're trying to figure out why. Well, it's because you're going through puberty. And as you go through puberty and experience these changes in your hormones and things like that, that can cause you to have breakouts such as acne. After you develop the breasts, after you start wearing the deodorant and noticing the acne, then you will start to see hair growth if you're a girl. And what I mean by that is hair starts to grow underneath your arm and in your pubic region. And you'll also notice that the hair on your legs may start to darken. As you continue to go through puberty, the hair under your arm and in your pubic region may also darken and become more coarse. After that, young girls experience a growth spurt. They get taller and they also start to get more curvy. So they start to have fat deposits in areas of their hips and their thighs. And that's all normal. We want to think that it's not normal. We want to take diet pills and things like that to kind of stop the fat deposits from happening. But we shouldn't do that because that's all a normal part of puberty and growing up. Lastly, the last stage or step in puberty for young girls is the onset of menses, meaning the start of your period or your menstrual cycle. That lets you know that you've basically hit the pinnacle of puberty. Congratulations. When we start to talk about young men, the first thing they're going to see externally is their testicles are going to start to grow and get bigger. So they're going to enlarge. So enlargement of the testes is the first sign of external puberty in a young male. Next, that's followed by hair growth underneath the arms and in the pubic region, and also the hair on the legs may start to darken as well. So similar to what happened in the young ladies, but in men, in addition to having the hair under your arms, in your pubic region, and the hair darkening on your legs, they may also start to see the hair growth on their face. So that's that peach fuzz that young men and young boys often talk about. They may also notice that their voice starts to deepen. It may also become more cracky or raspy before it starts to deepen. That's a normal portion or normal part of puberty. After that, then the young boys may start to notice that they need to wear deodorant because they now notice an odor and they may start to develop acne. After that is usually the growth spurt. So boys usually get taller. Their shoulders become more broad, and then they start to deposit more muscle. So they become more muscular during their growth spurt. So as you can see, puberty happens to both men and women, or boys and girls. It happens a little bit differently, whether you're a boy or whether you're a girl, but it does happen, and that's important to note. So let's move on to talk about whether or not you can speed up puberty. Well, The short answer is no. No matter what you do, no matter what you say, there is absolutely nothing you can do to make this process go faster or slower. It's going to happen, whether you like it or not. It's important to know that no two people goes through puberty the same. So you can't compare what you're going through with what your friend or someone else is going through, because we're all going to go through puberty, but we may not all experience the same exact things that the other person is experiencing, and we may not experience them at the same time. And that doesn't mean there's anything wrong with us. It's just the way we're built. There's also two medical conditions I want to talk about that's associated with puberty that may or may not be normal. There's something called delayed puberty and something called precocious puberty. So let's start with precocious puberty. For a girl, if you experience the onset of puberty, meaning the development externally of breasts before age 7 or 8, that's considered precocious puberty or early onset puberty. That may or may not be normal. In African American girls, they can sometimes go through puberty as early as 6, which is scary for a lot of parents, but that can be considered normal. So sometimes it's dependent on your culture or your race when you actually would go through puberty, and whether or not early onset puberty is considered an abnormality or not. If you're a boy, if you see the enlargement of testes or testicles before age 9, that's considered precocious puberty. And that may or may not be normal depending on the race or the culture of a particular person. When we start talking about delayed puberty, now usually there are some abnormalities associated with that. So if a young lady has not started menses or her menstrual cycle by the age of 16, that's considered abnormal. If she has not developed breasts or started to see the growth of her breasts by age 14, that's considered abnormal. Let's say she does have breasts, or she started to see the growth of breasts, but if she does not have menstruation within 5 years of developing her breasts, that's considered to be abnormal, and that is delayed puberty. And if that is happening, you should definitely have a conversation with your doctor. At that particular time, typically people are seeing a pediatrician, and it's okay to have a conversation with your pediatrician, with the adolescent gynecologist, or with the general gynecologist. We can all be helpful in those areas of explaining things and kind of helping you navigate through that. If you're a boy, if you don't develop your testes or have growth of your testicle region by age 14, that's considered delayed puberty. And that's abnormal, and you should definitely follow up with your doctor regarding it. So let's just review. Puberty is normal. It's normal to go through these changes because that's how you get to be an adult. Now, we all know there's more to being an adult than just going through puberty, but this is the first step. This is kind of like your rite of passage. And as we talked about it, the first stages or the first steps of puberty, you don't know, because it's all internal. It's behind the scenes. These are the hormonal changes that are going to mark the onset of puberty, whether you're a boy or you're a girl. That's the GnRH that we talked about, stimulating the pituitary gland to produce the LH and the FSH. That's going to target either the testes in boys or the ovaries in girls. And then you'll start to see breast growth in girls. That's the first sign of puberty. In guys, the first sign of puberty is going to be the growth of your testes. This is going to be followed by, whether you're a boy or a girl, at some point you're going to see the hair grow under your arm and in your pubic region. The hair on your legs are going to get darker. If you're a male, your voice is going to get deeper. You may start to see hair growing on your face, that peach fuzz, if you will. Whether you're a boy or a girl, at some point you're going to have to start to wear deodorant, or you're going to feel the need to wear deodorant because you're going to sweat more. You're going to produce chemicals that don't smell too great, and so you're going to want to wear deodorant to help cover that up. You may start to see the development of acne. You may actually have, or you should have, a growth spurt as well. So for girls, you're going to grow taller, but you're also going to become more curvier. For guys, you're going to grow taller. Your shoulders are going to become more broad, and you're going to be more muscular. These are all normal parts of growing up and becoming an adult. I hope this topic was super helpful and informative. Of course, there's so much more that I would love to talk to you about. If we had time, hopefully we can revisit this topic in the future and delve into it and answer any questions you may have. Thank you so much for tuning in. It was my pleasure to have this talk with you. I hope it really helped. Have a great one.
Here are a few points to remember from today's presentation. Do you have questions after listening to this Toys You Can't Return workshop? Well, please send all questions to our chapter email at E-Phi 2016IPL@gmail.com. We will be sure to forward the questions on to Dr. Wintria Cunningham so that you can get a response. Special thanks to Dr. Wintria Cunningham for conducting this wonderful workshop for our Toys You Can't Return mini-series. The work that you've seen today was created by our Epsilon Phi chapter technology team utilizing Adobe Spark videos and Creative Commons photos.